My honor to introduce Dr. Abdul Karim Exayez. In 2012, Dr. Exayez was training to be a neurosurgeon when his residency was interrupted. He joined Save the Children in Northwest Syria, where he led the health response until 2016. He's now a medical doctor, an epidemiologist, and a fellow at Chatham House, and is a research associate with the War Studies Department at King's College London, focusing on building healthcare systems in complex settings. Karim, would you be able to share with us why you had to stop your neurosurgery residence in 2012?
Sure. Thank you very much, Naomi, and thank you for the Holocaust Memorial Museums for all your efforts with relation to the Syrian issue. So for me personally, when the revolution started in 2011, I was in the middle of my training program in Aleppo University. And then I joined some of the kind of peaceful demonstrations in the beginning because, being a Syrian citizen, I was, part of these ambitions to have more freedom, participation, and other kinds of simple rights. But at the same time, I was, focusing on my medical profession, to be provided to all people regardless of their political affiliations. But basically, when the demonstrations arrived to Aleppo city, where I was doing my training in 2012, we were pushed as medical staff to not treat protesters properly. And sometimes, we were not allowed to admit some people to the hospital or to do the right care, like operations, or to undergo, different interventions. And we were told many times that those people do not deserve this care, and we will just, take them to either the prison or, do just the basics so they can, speak to the investigators, and then we will do the rest. And that's why, we were pushed by, our kind of moral obligation to do more, to reach out to the people who were not able to reach to us in the hospitals. And that's why in 2012, especially after the Free Syrian Army entered Aleppo in July 2012, where the city basically was kind of split between the government, the regime, and the opposition, we had to go, to homes sometimes to operate, even, I would say minor surgeries and also sometimes big surgeries at homes. And we established what is called field secret hospitals in some places in parts of Aleppo. The first field hospital I established was in a basement of a mosque, where I've done sometimes even big surgeries in this very, under-resourced environment. But at some point, it was not possible for me to manage between, being in a governmental run hospital, doing my training, and then going to the other areas, because, this will put me under, enormous risk of being arrested. And a lot of my colleagues who do the same were arrested actually. And that was, an indication that I could not continue my training program if I was planning to go to work in these field hospitals or to support those people in need. And I had to decide at some point either to continue my dream to be a neurosurgeon and to continue my 6 years training program, or to just give up my training program and go and help those people. And that's what I decided to do actually. In the beginning of 2013, I decided to go to the eastern side of Aleppo city to work in these field hospitals. And then I moved to Northwest, to the areas under oppositions. And here where I shifted my focus from, focusing on surgery. So I zoomed out to focus on, how to really, prepare a health response for those population, how to fill the gap generated by the withdrawal of the Ministry of Health from these regions, because all the regions that were controlled by oppositions, there was a complete withdrawal of all governmental services from these regions, where people, were, at the, they are the most needy population because of the continuous attacks. And that's where, I joined these local efforts to establish local coordination teams in terms of medical response, to establish hospitals. And then this was with the emergence of the humanitarian response, where a lot of international organizations and local NGOs were established. That's when I joined Save the Children in 2013, mainly because I was really interested in, doing more in terms of public health interventions, vaccination. And that's where we've done a lot of vaccination campaigns. With the emergence of the polio outbreak in 2013, in October, we've done massive door-to-door campaign. And, slowly the kind of the humanitarian response was growing up, and also the kind of the institutionalized local response was being strengthened over these years.
It's really, incredible, and really difficult decision that you had to make, but one that, really quite courageous. I can't even imagine what the conditions must have been like that you were working under. With the now 10 years of crimes that have been committed in conflict, what is the current situation like in terms of medical staff and the healthcare system in Syria, especially in those areas that are still under attack?
The kind of the healthcare system, or if there is a system at all in areas operated by different armed groups or by different non-state actors. So these areas, has witnessed the brunt of atrocities in the Syrian conflict. From the very beginning, where we established these field hospitals, we were under enormous risk. Two of my colleagues in one neighborhood in Aleppo city called Saif al-Dawla, two of my colleagues were burned inside the hospital when they were kind of caught by the security agencies, by the Syrian regime. A lot of, horrible things happened when, these field hospitals or secret hospitals were caught by the Syrian army or the intelligence services. And when we moved to northwest of Syria, the healthcare system there, witnessed a lot of attacks on health facilities, on health personnel. First, a lot of health personnel were detained and killed under tortures. I have a lot of friends who were really, killed under torture in the Syrian prisons, and they were kind of, some of them who were released, they were telling us stories about what happened with them in detention. They were pushing them hard, torturing them, because the claim was that you are doctors, you need to serve your regime, without any kind of humanitarian principles about serving the different people without regardless of their political affiliations. And then attacks on health infrastructure was a major challenge. In 1 year alone, which is 2016, there was more than 200 attacks on health facilities. A lot of organizations, international and national organizations, they documented these attacks, which I think it is, unprecedented. There is no kind of conflict that I've read in the literature or that witnessed this large scale of attacks on healthcare and health personals. So now the health system is even more stretched without proper resources, because the humanitarian response usually the resources were kind of being dried out, and a lot of donors, they lost interest in supporting these responses. Just a few days ago, I was watching a video, it was by a Russian television. They were filming a hospital called Al-Maghara Hospital, or the Cave Hospital. This was in northern Hama. This hospital was built inside a mountain. And just a few days ago, they were blasting the whole hospital just to not be used for other purposes. But I remembered when this hospital was established, it was established by a doctor called Dr. Hassan Al-Araj, who was the head of the health directorate of Hama at that time in 2015. And the idea was to protect the healthcare kind of inside a mountain. Although this hospital was targeted more than 20 times in 2015 and 2016, in one attack, Dr. Hassan Al-Araj was just leaving the hospital and his car was targeted by a missile, and he died in 2016. And now this very hospital, so after the regime took over large areas in northwest of Syria, they took over these areas and they blasted the whole hospital. So it tells you, kind of the brutal campaigns, the military campaigns that healthcare were faced with, and also civilians in general, because I would say health infrastructure and health personals were treated, in the same way other civilian infrastructure were treated. Even, I would say, even with more targeting because of kind of the nature of these vital services. But until the moment, I think a lot of civilian infrastructure and health infrastructure is still under attack, especially in the areas in northwest of Syria, where the regime with their allies, they always push to take over these areas, risking the lives for more than 4 million people in these areas.
I'm always struck by how remarkable and innovative the Syrian medical community has been and civil society community has been in trying to find ways to continue to provide care under the most dire of circumstances. The idea that people will continue to keep working underground, in caves, knowing that they are being specifically tracked and targeted simply because they provide life-saving assistance is truly astounding and humbling to think about. And, one of the tragedies is that that's in large part because we have yet to, as an international community, find a way to bring an end to the killing. What is the current situation like in Syria today? You've talked about how it's incredibly difficult for people to actually find and access medical care in certain parts of the country. How has the COVID pandemic impacted the healthcare system?
The COVID-19 attacked these areas with a health system that is unprepared to deal with any health threat. The daily targeting of health infrastructure puts more than 50% of the health facilities in areas out of the control of the regime. Either they're not functional at all or partially functioning. And also kind of the resources required for such response were really limited. I know, for example, in northwest of Syria, the total number of ventilations was something around 100 for serving 4 million population. So the occupancy rate of these ventilators were always 100% because of the continuous needs and attacks and threats. So there was really kind of no resources to scale up a response for the COVID-19. And also people, they're not kind of interested in preparing for the COVID-19 amidst all the other risks, because their lives are targeted on daily basis. So they do not see the risk of COVID-19, comparable to the daily targetings or the lack of resources and the lack of basic livelihoods in these areas. But I think there were some innovations as well in the response. Some institutions, they took the lead. I will give example, which I've published a paper on this about the role of unusual actors to establish a governance to respond to the COVID-19. In northwest of Syria, two institutions in particular, which is Idlib Health Directorate, which is kind of a local health authority, but it's only a technical one without affiliation with any governments. And the second one is the White Helmets, the well-known Syrian civil defense. These two institutions, they took the lead to establish, a voluntary campaign, inviting all communities and individuals to take part in. And they named the campaign Volunteers Against Corona. And this was the only way to, mobilize resources. And they were able to, scale up the response in many communities. I think they were successful in support from, for example, the Early Warning and Response Network run by the Assistance Coordination Unit to establish the testing system and other kind of community-based systems. But still, the budgeted response was only funded by around 5% or like 5 to 7%, which is really nothing considering the stretched health system in the region. Similar situation in northeast of Syria, actually, where the self-administration, they were struggling to prepare for the response. And I would like to highlight one issue, which is the cross-border aid. Because as you know, the security resolution, the Security Council resolution in 2014, 2165, to allowing the UN agencies and their partners to send supplies across the border, this has expired. And because of the Russian and the Chinese vetoes, it was not possible to extend this resolution. As a result, northeast of Syria were relying only on aids coming across the line from Damascus, which proved to be ineffective. And there were a lot of reports telling that even the COVID-19 response in northeast of Syria was slow and ineffective because the WHO, for example, they were not able to send aid across the border from Iraq. The situation in Northwest is slightly different because this cross-border resolution is still valid, but only for, I think for 6 months, and there will be another maybe expected veto by the Russian and the Chinese to stop this. And that's why there is, dire needs to put a lot of, pressure on governments in the Security Council to allow this resolution to be extended.
Yeah, it's distressing to know that the Russians are able to not just provide assistance through military assistance that is impeding the ability to provide life-saving care on the ground, but they also use their political position on the Security Council to use the veto to similarly target Syrian civilians. So it's from every aspect, they're working to undermine the well-being of your friends, family, colleagues. Dr. Exayes, if you were to say anything at this 10th anniversary to the American public and policymakers, what would be your message to them at this 10th anniversary?
So I would like to say that, Syrian people, they went through, huge sufferings in over the last 10 years. And these sufferings were visible to all people. And that's the difference between previous genocides that maybe you heard of but you didn't see, while now you see everything on a daily basis. Some people, they risk their lives to document these issues. The notable films For Sama and the Cave that were nominated for the Oscar, those people were really risking their lives to document and visualize this suffering, to show it to you. And the Caesar photos that people were trying to leak photos and documents to prove that, look, these sufferings, we're not making up stories. These stories are real, and we're risking our lives to prove that this is kind of the real situation that we are suffering in Syria. So we still have hope that the American people and the USA would, help the Syrian people even more. In the previous years, where there were some kind of disappointing moments when, for example, in 2013, after the chemical attack in eastern Ghouta, all Syrians were sure that something would happen. The international community and the US will not allow this to continue. And unfortunately, nothing happened. And we would like to remind them that, these chemical attacks and these violations, the barrel bombs, all of these were documented, and there are tons of evidence that the Syrian regime is responsible of these attacks. So it is time now to put, the Syrian regime accountable, to hold them accountable, and also to say to the world that there is still a justice. Because, the caveat is that if perpetrators in Syria, they enjoyed impunity, I think this will risk the whole, system in the world, that, other perpetrators, elsewhere will say that we can do whatever we can without, without the fear of being held responsible and accountable. So I think there is a kind of moral responsibility of the international community, of the US, to act more. Because now I think after 10 years of the conflict, and I think the situation is very clear. There is, maybe in the previous years, people were fearing from Daesh or from terrorism, or now the situation is clear. There is, the number one perpetrator in the Syrian crisis is the Syrian regime. And this regime needs to be held accountable. And there are, the continuous humanitarian sufferings that should be supported. in terms of, funding and supporting the humanitarian response, supporting people who are documented these violations, and then, supporting accountability mechanisms that will bring these perpetrators to justice.
Thank you so much, Karim. That was incredibly powerful. And I'm just sorry that you have to, I'm sure, every day convey these messages in the hopes that something is actually done. Just separately, Karim, like on the humanitarian assistance, it's, from day one, we've been arguing that there hasn't been enough assistance. There has just been this constant recognition that the international community doesn't have the political will to try to stop the conflict, but they're also really struggling to continue to find the political will to even just provide assistance in the very basic forms of, food, medicine, the work that the White Helmets and others do. Again, I'm just always struck that they're the ones that you all have to bear the burden, because the rest of the world isn't actually living up to its commitments and its responsibilities. It must be surreal for you to be kind of working on this and studying it alongside other conflicts that you're studying at King's College as well, and kind of doing research on, and just realizing too that, more and more people are just talking about normalizing relations, or talking about, well, Assad has won, it is done. That it's mind-boggling to see that. How are we going to see the pursuit of justice and accountability alongside a conversation that we should all just accept that Assad has won?
And that's really, very disappointing when we see that some governments, they just, ignore their responsibilities, and they accepted the reality that Assad has won, parts of the country. But we will say that, the situation now is different. Maybe, Assad in the past, or the Assad father, was able to, control, the Syrian territories with with fire, but now the situation is different. Now there are large territories out of the control of the Syrian regime in northeast and in northwest. And also there are at least half of the country population, they are displaced, either internally or externally.
Yeah.
The Syrian diaspora now, we have more than 8 million refugees. Even, just the people who were displaced or fled the country after 2011. So those people, they have their links with Syria, and they will not allow the Syrian regime to kind of win and then, go back to the, the situation before the revolution. And that's why we always urge governments that you should be mindful that normalizing relationship with the Assad regime means that you are undermining the whole international system. So it's not about your interest as a country or as government or institutions. It's about the long-term consequences of normalizing such regime in the international system.